industries can be articulated or positioned anywhere along this spectrum, which measures the extent to which value can be created, priced, and valued by those who create it. And so there are some industries where in a particular component you can, if you just spend more money here, you can actually reduce the cost and improve the performance of a product that's a different component by a different company. And I can't do this here unless I get permission from these guys and they invest there. And there are a lot of industries that have that kind of interdependent structure to the problem. Almost always, the companies that are successful are integrated. They have to be able to wrap their whole arms around all of the components that interdependently impinge on all of the other components. But there are other industries where the structure of the product is very modular, and the technology is so clear that you and I can deal with each other at arm's length, because I can specify what you have to deliver, we can measure what you specified, and there aren't any unpredictable independencies. And so in that structure, individual components can work on their individual problems and interact with others through a price, and people who create the value can capture the value. There are far fewer interdependencies in that way. Now the problem with this is that if you want to just rethink the system, nobody can do it here. So if we then come back to this and ask, where is healthcare today? In healthcare, it is excruciatingly interdependent. And so many things you can't do because you have to get an independent insurance company to say you can and you can't. And you might be able to, like in diagnosing the correct disease, as happened with Dave Snow, the system wouldn't pay for the cost of getting a clear diagnosis, because you pay the money here, but the outcome is developed over there. So it's not, should government pay versus private pay? That's the wrong categorization. It turns out that we're in this situation, and people that are organized that way typically can provide better care at significantly lower cost. These guys spend a lot of money, and they feel that their customer is the patient. This person has type 2 diabetes, as you can see, and the doctor is the patient. And so they keep targeting them. But if you really think about it, in terms of what job are these guys trying to do, this customer, his job on average is, I think I want to just not be sick. And if I'm sick, if I felt okay today, that means in all probability I'll be just fine tomorrow. And I think that God has exempted me from the problems that will happen to everybody else. Or maybe I'll start tomorrow. But essentially, they just don't want to be sick. And on a piece that we did showed that between 15 and 20% of Americans, when they're well, they want to maintain their wellness. For the 80 to 85% of people who are well, they don't want to think about health. When we're sick, we all want to become well, but when we're well, it's just a small portion of people that cares. And so by targeting these products to people who don't have a job to be done, and doctors actually can only make money when patients are having the complications of their disease, not by preventing it. And so these are exactly the two wrong customers. Who are right is the caregivers that have to care for this person. They really have an incentive to make it right. And then data that helps the customer every So I feel this in my own. If the data that came from the providers of the equipment to Clay every day reminds me that I'm sick. Clay, you are a sick guy. It will cause, then I have a job to be done. But if all they sell me is, anything that's not, and then the other one who really has a job to be done are the doctors, I'm sorry, the employers. If you think of all of these things that are affected by health that affect their profitability, they have a very strong incentive to keep their customers healthy. And I don't think that for all kinds of reasons the government doesn't feel that job nearly as intensely as employers feel it. If I go back in history, the hospitals were established in America, at least, in an era when transportation was inaccessible or very expensive, and doctors were quite cheap. And what that meant is you wanted to have a hospital in every community, because that minimized what was expensive and utilized what was expensive. But now everything is flipped. And so transportation is cheap and doctors are very expensive. And yet we still kind of are organized around the hospital system that was established to when the constraints were totally opposite. So then you do that, and then sophisticated technology comes in. And because the hospitals exist, then we try to build the emergency next to a hospital. But the hospital is organized like the Pontiac plant. And so here's a patient comes up to an emergency, and then about 90% of the time in the emergency room, the patient is waiting for something to happen. And so I'm sitting there because they got to take me to radiology, and then I sit there because, and then I sit there and I sit there, and then I come back, and then I sit there while somebody come to take my blood, and then I sit there while it goes over to, and then and it's organized to do anything for anybody at a hospital system. In reality, if you take those machines out of that place, and just like they did it in Maysville, Ohio, organize it to get people in and out of an emergency room fast. You make money when you flow people through fast in terms of the job didn't need to be done. And experiences or experiments that we have done in that way, where the whole hospital is organized around the general or the emergency room. It's focused on being a solution shop in that way, and it just makes a totally different experience as well as very profitable. There's another really good example in originally dialysis had to be done in the hospital. The hospitals just drove their knees in and wouldn't allow clinics emerge that you just went there to have dialysis done. But ultimately those guys disrupted the hospital activities in dialysis. And now there's a company in Lawrence, Mass, called Next Stage Medical. And these are little devices about the size of this, where you can have it in your home and provide that your wife can hook you up every night and do it. And it's disruptive relative to the clinics. And is this an exciting growth opportunity or a threat? For one, it's a threat. The other one is, and so if these guys would view it as a growth opportunity, it actually would be, and ultimately you just wouldn't need to have nearly as many clinics. But more people would be much better off at lower cost if they would view it that way.